All right, so now we're gonna be testing passive range of motion for the hip for medial rotation. So you're gonna make sure that your patient is in proper posture so that the pelvis is stabilized, and you're gonna make sure that the hip is in 90 degrees of flexion, and the knees in 90 degrees of flexion, and the leg is also in 0 degrees of abduction and adduction. You can put a towel or a sheet under the distal femur to make sure that that hip is in 90 degrees of flexion. So your landmarks for the fulcrum is going to be the patella, so you want to palpate that and have the fulcrum already in place. And then your distal arm is going to be with the anterior midline of the leg, and your proximal arm will be perpendicular to the floor. So I'm going to move the proximal arm out, and while you're moving them, you want to block their distal femur with your hand and then move their lower leg with your other hand. So about right here is where I feel resistance, and I feel the leg start to abduct into my hand, and I'm going to make sure that the goniometer is lined up with the landmarks. So to make sure that this is perpendicular with the floor, and right there is where we have it, and that is at 28 degrees of medial rotation, which is just out of our normal range.
All right, so this is the alternate test for medial hip rotation. So we're gonna start by flexing the ipsilateral knee to 90 degrees while the contralateral leg is in full extension, or contralateral knee is in full extension. Our Goni landmarks for this test are gonna be fulcrum at the anterior aspect of the patella, while the proximal arm stays perpendicular to the ground and the distal arm stays at the midline of the lower leg. We're going to immediately rotate the patient until we get to a firm infill. And that's going to put us at 27 degrees of medial rotation, which is just shy of normal range.